copy of the recording. So I'd like to start with looking at immunity and understanding what that actually is and what builds the immune system, and sort of what we know and where it arises from. And what we know is that immune system comes from birth, right? And we inherit a lot of that from the childhood that we have, and the type of birth we have as well makes some difference. So, for example, we now know that when we have a vaginal birth as opposed to a C-section birth, we have the beginnings of natural probiotics down the vaginal canal, and that when we don't have that, we know from the research that in childhood we're much more set up for inflammatory based conditions. The most common ones would be eczema and asthma and hay fever, right? Not to say that obviously if you have vaginal births, you can't still have those inflammatory conditions, but we know the incidence of those is higher. And what we do know is that a lot of that could be down to the microbiome, or an element of dysbiosis within the microbiome. So that's a starting point. And also we need to look at the hygiene hypothesis as well. So we have this very sort of sanitized world we live in now, which is not really conducive to building the immune system. So the adage of playing in dirt is a really good one, because dirt and soil has microorganisms in. And what we now know as well is that things like farming communities and have a much lower incidence of allergy or autoimmune conditions and immune-mediated conditions. So the more sanitized the environment we're living in, the more chance we have of not having a developed immune system. So the idea of having pets, exposing children to farm animals on a regular basis is a really good idea. And the idea of having a dog or a pet is actually very good for the immune system. Obviously, some people don't do well with dog hair and what have you, having the allergy in the first place, but you can get obviously non-molting dogs or allergy dogs like a Labradoodle, but like my dog, the Poppy dog. So that's another aspect we have to consider. And also the soil and what the soil contains and the nutrients that the soil contains is very much conducive to our own immunity. And obviously for a number of years, we've been destroying the soil and the environment. So that will then impact on our immunity as well. Also, again, controversial subject, but vaccines can have been shown to reduce innate immunity. And there's good research around that. So when you have vaccines, regardless of what the vaccine is, that the body's own innate immunity is reduced to fight off day-to-day infections as a result of having vaccines in the first place. And that's something that people can look at some, say, Stephanie Seneff's research in that area, who's an MIT research scientist, one of the leading authorities in the world on glyphosate as well. And again, glyphosate, just to mention that, obviously glyphosate is what's in Roundup, which is a chemical used to spray onto crops to get rid of pests and weeds. And what we're finding is that has a big disruption to the microbiome. And interestingly as well, if you look at Stephanie Seneff's research, that some of the research that she did, she found that the areas where had the highest levels of glyphosate had some of the highest incidences of COVID as well, and COVID complications. So that's something to be mindful of as well. So when I think of immunity with people, obviously, what I'm thinking of obviously is the cause and why people's immune systems have been challenged. And a lot of it for me comes back to childhood. And within childhood, many people have early childhood trauma. Now, some of you will be aware of the work of Gabor Mate. He uses a term of trauma with a small t, right? So what we know is even before Gabor Mate's work, we know about the ACEs studies, which are about adverse childhood event studies, which show that the more adverse childhood events a child has within their upbringing, the higher the incidence of chronic illness and autoimmune disease later on in life. And once they have 2 or 3 adverse childhood events, that incidence goes up dramatically. So what Gabor Mate calls trauma with a small t, he's referring to not having enough early life nurturing care. It doesn't have to be a major trauma like losing a sibling or something like that, or a car accident or what have you, but it's ongoing lack of nurture care. He also quotes in his latest book about, did you as a child have someone to go to when you were in trouble or upset or had a problem, someone you could turn to? And a lot of people don't. Maybe with strict parents, overbearing parents, not having unconditional love as a child. So that basically sets up the immune system for an element of hypervigilance, and not having a measured immune response. And what we tend to find is, so what I'm doing here is taking you on a journey of how I've seen it play out with patients over the years, and having seen tens of thousands of patients with immune-mediated conditions, how I've seen the trajectory of the immune system becoming dysregulated. So that journey then continues later on in life, where there's been quite a lot of trauma and different childhood events. And then in some cases, there can be an infection that someone picks up at some point in their life. Could be something very common, like, I don't know, Epstein-Barr virus, glandular fever, right? And someone could be ill for a number of months, and then they may knock it out, and that may be all forgotten about. And later on in their life, they get another stressful event, something like a bereavement or a loss, or something happens in a relationship, or they get some sort of flu bug or gastrointestinal bug, something of that nature. And what I tend to find is, with patients that we see at the clinic with long-term immunity issues, is that they were doing all right up until a certain point in their life. There was a stressful trigger or an infection or something like that, a stress to the immune system. And after that, the body was not able to maintain its homeostasis and its regulatory mechanisms. And what the body was then happily dealing with previously, it's unable to now deal with. So, for example, someone might have some, I don't know, mercury amalgams, silver amalgam fillings in their teeth, which are made of mercury, which is the most toxic substance there is on Earth, right? Unless you class plutonium, but that's man-made. And the body may well have been happily dealing with the mercury that the person had in their teeth. But what they find is, after the latest immune trigger, they're unable to deal with all the things that the body was dealing with previously. And if I give a bit of a metaphor, you've got, let's imagine a bathtub with a drain, you know, the drain as you drain the water out the bathtub and the stuff coming in. So if you imagine the bathtub, the drain isn't working as well as before, all the other stuff is coming in and it's getting overloaded with the stuff that it was happily dealing with previously. So what I tend to see with patients is that they will have, say, some sort of immune-mediated or autoimmune diagnosis. There's been historic trauma when they were younger of some shape or another, historic infection, some sort of trigger, and after that trigger, the body is unable to deal with all the stuff it was dealing with happily before. A lot of people get into integrated medicine in this field because of historic illness themselves. I was certainly most of the clinicians in my team got into it this way. I was a bit more slightly different in my journey into that, is I never really came from illness originally, but then I did get ill during COVID. And this is a sort of, to illustrate this, I've always been someone who's enjoyed very robust health. But during COVID, I caught COVID, was living in a rented house, and I couldn't understand why I was so ill. I was ill for like nearly a year. And I realized that the house I was living in was incredibly moldy. And I got a survey done for the house by some environmental people called Action Dry, and it turned out it's one of the moldiest houses they've ever surveyed, albeit there was nothing visible. So it was like a perfect storm. I had the body being stressed by being in a very toxic environment, but then obviously getting an infection as well, and then obviously being ill for nearly a year. And so that's just a sort of an illustration, even from my own story, as to how there comes a point where the body can't take any more. So, and then what happens is that the body is meant to have a measured immune response, one that's day-to-day vigilant, but not overreactive. what we see in many of the patients at the clinic is that the body then has an unmeasured immune response, like say with conditions such as mast cell activation disorder, mastocytosis. The body is basically reacting to itself, right, really, and is unable to produce a regulated response to the environment. And a lot of the time, again, that comes back to the trauma. The body is ultimately in the freeze state. And there is now really good research to explain that by a guy called Dr. Robert Navio, who has coined something called the cell danger response. And that's basically almost like an illustration of how the body gets stuck in the freeze state. So not quite the fight or the flight state, but the freeze state, which maybe less people have heard of. But that's where a lot of the time the body then shuts down, becomes super sensitive to things, to smells, to chemicals, to foods, all sorts of stuff, and then is unable to deal with that. So a lot of the work I try and get patients to do is to deal with the historic trauma, deal with some of the toxins, let's say that there's latent in the body, whether it's heavy metals or mycotoxins or environmental toxins. Also looking at latent infections as well, because a lot of, I think one of the leading autoimmunologists in the world is a gentleman called Dr. Yehuda Schoenfeld in Israel. He says that all autoimmune disease is caused by an infectious etiology to prove and otherwise. And I respect that. I wouldn't say it's completely true of every case, but we now know that certain autoimmune conditions are linked to certain infections. So, for example, we know that Hashimoto's thyroid, which is one of the most common autoimmune conditions, is linked to latent Epstein-Barr virus infections or Yersinia infections. We know that from the research from Professor Alan Erbringer from UCLA, who's now retired, we know that rheumatoid arthritis can be linked to an infection known as Proteus mirabilis. Other ones we know about are multiple sclerosis being linked to an infection by chlamydia pneumoniae. Now, that's not the sexually transmitted chlamydia, it's a different species of chlamydia. And one of the greatest masqueraders that we are well aware of now is obviously Lyme disease. So many patients get diagnoses of certain autoimmune conditions such as rheumatoid arthritis or MS or motor neurons disease, ALS, and lupus, when actually they don't have those conditions. They've actually got a latent infection by Borrelia burgdorferi, which is the bacteria that causes Lyme disease, and obviously the co-infections that can go alongside that. Sometimes patients have both, but there is very much often a misdiagnosis. And what I found over the years is that when patients come to the clinic with autoimmunity, then I'm often looking at latent infections and trying to treat those infections to then help the patient get better from these symptoms they're experiencing. And the way that this often happens within the body is by two mechanisms, one known as the bystander effect, one known as molecular mimicry. What tends to happen is, say, for the example of, let's take Hashimoto's, which is the most common autoimmune condition. The body recognizes proteins, and let's say those proteins are A, B, C, D, and E. But everything has a protein structure, and sometimes, let's say that for the thyroid, that has the surface of the thyroid has a particular protein structure. And what happens is the body has a case of mistaken identity, which is basically what autoimmunity is about. Let's say someone has Epstein-Barr virus, the body then starts attacking the thyroid, thinking it's attacking Epstein-Barr virus, because the protein structure of the surface of the thyroid and Epstein-Barr virus are very similar. And there's the case of mistaken identity, and that's when the patient starts experiencing the usual symptoms that might go with something like Hashimoto's, like fatigue and brain fog and lack of sleep and headaches and that sort of thing. And again, so stress, which I mentioned earlier, has a massive, massive impact on the immune system. I think that if you said to me, what's a perfect recipe for upsetting someone's immune system, it would be lack of sleep, eating a really poor diet, high stress, and even shift work. If you're doing weird shift patterns, like working in the night and things like that, that would be a perfect storm having problems with your immune system. So some of the foundations of having a good immune system are high quality sleep, decent diet that's high in polyphenols, antioxidants, high amounts of vegetable intake, high levels of spices like turmeric and things like that, and actually having a measured stress response where it's impossible to live in a world where we don't have any stress, but it's how we deal with that and having that downtime. And I know, even though with like some of my friends, you know, when I speak to them, it's like and, you know, I see with patients and friends, you know, that there's no time made for, you know, to engage in that relaxation response and deep rest. You know, we've ultimately become human doings rather than human beings. And finding time for deep rest on a regular basis is really important. And the question is, how does one do that? It could be in many number of ways. It can be meditation, it can be prayer, it can be doing work in sound work or sound baths, yin yoga, meditative forms of dance. It's basically about slowing down. Those are just some obviously possible examples of how to improve the immune system. Also, other ways of improving the immune system via the stress response is looking at things like amygdala or limbic system retraining. And there are a couple of systems out there, such as the Gupta program or the DNRS system from Annie Hopper. Is another approach I quite like. Again, with the immune system, I'm quite a fan of using herbs. Being a herbalist, I like using herbs. And herbs have multiple properties, and you can blend them up in large bottles and have a good mixture of stuff. So, for example, you could use with patients as a general immune mix, which could be taken, you know, in variations throughout the year. Things like Schisandra, Echinacea, Siberian ginseng, rhodiola, tulsi. There's a whole heap of immunomodulating herbs that people can use. And other ideas could be medicinal mushrooms. So things like reishi, lion's mane, chaga, maitake. So there's a lot of options with the medicinal mushrooms as well. Also, obviously, your classic immune nutrients would be things like vitamin C, yeah? And a lot of people now are using intravenous vitamin C, which obviously we offer at the clinic. And we know from the research and the work done by the Linus Pauling Institute of the good results that people get even with high-dose vitamin C for cancer, let's say. And that has had very good results for some of our patients and across the world. And, you know, vitamin C can knock out, as an antioxidant, can knock out any type of bug at the right dose. So it has been said that, you know, if you're on some like trek in the jungle somewhere and you were bitten by a super poisonous snake and you didn't have anything to treat yourself with, if you happen to have, highly unlikely, but you happen to have 100 grams of intravenous vitamin C on you, you'd be absolutely fine, because there's very little that can survive very high levels of ascorbic acid. And some of the cancer therapies go up to about 500-600 grams a week. From a home perspective, you can do vitamin C to bowel tolerance, which is using in the powdered form. And it's basically taking vitamin C, a few grams every half an hour, it produces a bowel loosening effect. And then you go back, say you reduce the dose by 20% and you take that each day. And that's a really good way of supporting the immune system with acute infection and chronic illness. And also doing the sort of Dr. Sarah Myhill approach, using an iodine salt pipe, which is getting a salt pipe filled up with salt and putting a few drops of Lugol's iodine into it, and then breathing that through your nose and inhaling it, because very little can survive, very little bugs can survive iodine. Again, for the immune system, no talk for the immune system would be a talk without talking about the gut. And, you know, we know that 75–80% of the immune system is located within the gut environment. And things that can be done to improve that environment are regular bowel cleansing with herbs, antimicrobial herbs such as neem or garlic and things like that. And then also supplying the gut with the sort of the foundations of what it needs in terms of prebiotics and probiotics. That can obviously be done through diet and eating a rainbow of biodiversity. Also with sort of butyrate, which is in butter or in supplemental form. There's a whole heap of different types of probiotics and prebiotics and forms of fiber. Prebiotics and probiotics now are so There's gazillions out there at the moment, and different probiotics have been shown to have different benefits for different particular conditions. So historically, we didn't have so many probiotics available to us, but nowadays we have almost like a different probiotic for each condition or situation we're met with a patient. And again, probiotics can be consumed obviously through diet, through kefir or water kefir or sauerkraut. Obviously, we're not aware of whether that reaches the gut environment, but I have had myself and many patients have benefited from taking natural probiotics at home. So also with immunity, like I said earlier, you have the body tends to lose a lot of tolerance to the things that are already in it. Let's say even things like implants. So I've had patients with titanium implants in the ankles and the legs, also implants within the teeth, such as titanium implants. And what we found is there is testing we can do for this to see if patients have lost immune tolerance to the implants they have. And sometimes as part of the treatment program, we get patients to have those implants removed and change the materials that are more hypoallergenic and they can get on better with. And then patients can have really, really good results on us with things like chronic fatigue when they remove implants that they've lost immune tolerance to and replace with something more tolerable. I went a few years ago to see a fascinating lecture from a podiatrist working from America, who had a lot of patient audio testimonials as well. And the amount of results he's had with changing titanium implants for people with chronic fatigue has been really quite fascinating. Again, also, what we also tend to find is chemicals, like I was talking about earlier. I had a patient yesterday where it turned out he was involved with engineering and welding for many, many years, and also he had incredibly high mercury levels on his mercury test. I only found out yesterday that he was in welding and engineering for many, many years. And what we find is patients who have had long-term exposure to chemicals and sort of working in those types of environments, the detoxification pathways are really not working particularly well. And they need a lot of detoxification support. So that particular patient, he's come in with tinnitus and bloating and other symptoms. And I do believe that the reason he's experiencing that is because of long-term toxicity. So that, I think, is a sort of a whirlwind tour for me in terms of the immune system, what challenges it, where it goes wrong, the type of patients that we see, basic things we can do to try to improve the immune system. Also, from an acute perspective, I do find that if you get sort of acutely ill with some sort of bug, one of the best ways of knocking things out, I found, has been to, like I say, do the vitamin C to bowel tolerance, do the iodine salt pipe, but also do high dose vitamin D. So daily people should be taking 5,000 IUs anyway, everyone should. But high doses when you're ill would be somewhere between 50 to 100,000 of IUs for 3 to 4 days. And also doing 100,000 IUs of vitamin A as well, for a couple of days. That sort of combination, when you're getting sick or a bug or a flu or whatever it might be, does tend to work really, really well. Also, there's a lot of sore throats going around at the moment. I've had it myself. And zinc is it's a very good nutrient, but in the form of zinc lozenges for acute illness, do remember to use zinc lozenges as well. I sometimes forget myself to use the lozenges because they've been shown in the research to be more effective than taking capsule form of zinc. So we've got a few more minutes for questions. If anyone wants to ask a question, they can do so in the chat box. And as I say, the recordings will be available for these talks and the other ones. And I hope you found it useful today. We'll keep the Zoom call open for a couple more minutes if anyone wants to pose a question in the chat box. They are more than welcome to. The recordings can be accessed probably after the series is finished. So we've got one more next week, and then they'll be made available as a whole on a YouTube page for everyone to use, to listen to when they want. Someone's asked about Coxsackie with Lyme, without Lyme. Yeah, of course you can. Coxsackie is effectively foot and mouth disease, and it's one of the most ubiquitous viruses out there. So yeah, Coxsackie, inevitably, if you test someone for Coxsackie, then they're always going to be positive, certainly on like an antibody test, because we've all been exposed to it at some point. Same like with Epstein-Barr virus. You know, if you go and do IgG antibodies to Epstein-Barr virus, nearly everyone is going to test positive because there's been historic exposure. Mold survey question is the only people I would use, and I would be very careful with this, the only people I would use for mold surveys in the UK is a company called Action Dry. I really wouldn't use anybody else, because I've been doing this long enough years now, and you know, these guys offer the best service, the best techniques, the best tools, and the best manners and humility and behavior with patients and clients that I've come across. So yes, I would only use Action Dry. And they do have a device which is quite interesting called a mold scope, which gives you real-time information when they come around your house and measure the levels. You don't have to wait for samples to be sent off and things like that. Although they do that, but you know, I would use them. Someone's asked what was the 3 main things that helped you recover from COVID in the end. Thanks, Kelly. I mean, I got COVID twice, and I was living in a very moldy house, and I was really ill for a year. I was like one of my patients, and what helped me recover the most, I think, just patience. I think just having patience. Weirdly, I didn't, you know, I was throwing everything at it in terms of herbs and all the rest of it, but I wasn't really getting that much better. And I think eventually I just surrendered to it, and eventually, you know, week by week, month by month, things improved. In a way, it was almost like, weirdly, like the less I did, the more I get better in some ways. And I'm not saying that that's the approach that's going to work for other people, but it seemed to work for me. The more I accepted it and sat with it, periods of fatigue and all the rest of it, it seemed to pass over a period of sort of 15 months. So yeah, that may not be the answer you're looking for, but that's the truth. So just as I thought I just mentioned as well, obviously, if anyone wants to get in touch with the clinic, anyone's not already a patient of the clinic, feel free to give the clinic a call if there's anything you need any help with. And there is also the ability to book a discovery call to see who would fit your needs most on our website, if you wanted to work with someone at the clinic. We've got a very good team of around 10 clinicians who specialize in different areas. We've just moved to a new premises in Marylebone, and most of us work online, but I work face-to-face with patients, and I see a couple of patients a week as well. And my number is very limited, so as to offer everyone the best service as possible. So yeah, thanks very much everyone for joining us today, and hopefully you'll join us next week for another exciting talk. Take care, lots of love, all the best.